Benzodiazepines. GABA is a main inhibitory neurotransmitter in the brain, which reduces the neuronal excitability. Benzodiazepines enhance the response to GABA by facilitating the opening of GABA-activated chloride channels. They bind specifically to a regulatory site of the receptor, distinct from the GABA-binding site, and act allosterically to increase the affinity of GABA for the receptor. Benzodiazepines are categorized based on their duration of action into four main groups. Ultra-short-acting benzodiazepines. These benzodiazepines have the shortest duration of action, typically lasting for less than 6 hours. They are ideal for situations requiring quick onset and rapid resolution of effects, such as in sedative effect. Examples: midazolam, triazolam, short-acting benzodiazepines. These drugs have a duration of action of about 6 to 12 hours. Examples: lorazepam, temazepam. Intermediate-acting benzodiazepines. These benzodiazepines have a moderate duration of action, lasting between 12 to 24 hours. Examples: nitrazepam, alprazolam. Long-acting benzodiazepines. These drugs have the longest duration of action, typically lasting over 24 hours. They are used for the management of seizure control. Examples: diazepam, clonazepam. Let's understand the pharmacokinetic properties of benzodiazepines. Lipophilicity with onset of action. Benzodiazepines with high lipophilicity are rapidly absorbed and distributed into the central nervous system, which leads to rapid onset action, such as diazepam and midazolam. Benzodiazepines with low lipophilicity have slower absorption and CNS penetration, which leads to a slower onset of action, such as lorazepam and oxazepam. Benzodiazepines are strongly protein-bound, which influences their distribution in the body. Benzodiazepines undergo hepatic metabolism, primarily via conjugation into glucuronides. The metabolites are then excreted through urine. Pharmacological effect and uses of benzodiazepines. Anxiolytic action. Some examples include alprazolam and midazolam. These medications are not considered as first-line treatments for anxiety. Instead, the first-line choice is SSRI, which are widely used for long-term management of anxiety disorders. Anticonvulsant effects. Common examples are clonazepam and diazepam. These medications are long-acting agent to withstand against seizure. Sedative hypnotics. These medications primarily used for sleep disorders like insomnia. A commonly used sedative hypnotic is zolpidem, which belongs to the class of non-benzodiazepines. And other uses are muscle relaxants, anterograde amnesia, anesthesia, and alcohol withdrawal. Side effects of benzodiazepines. Central nervous system depression. Benzodiazepines act on the CNS, often leading to side effects such as sedation, drowsiness, and fatigue. Elderly individuals are more sensitive to the sedative effects of benzodiazepines due to impaired body function. It may result in toxic effects, such as severe sedation. This increases the risk of falling, which can lead to fractures or other serious injuries. Benzodiazepines may cause respiratory depression in its higher toxic dose. Normal dose may also cause respiratory depression in addictive effect with other CNS depression. Example: alcohol. Benzodiazepines produce tolerance and dependence, and they need dose escalation to produce the required effect. Stopping benzodiazepine treatment after weeks or months causes withdrawal symptoms, such as anxiety, together with tremor and dizziness. Withdrawal after chronic administration causes nervousness, tremor, loss of appetite, and sometimes convulsions. Competitive antagonists of benzodiazepines is flumazenil.